friends. This is the Maladaptive Daydreaming Disorder YouTube channel. And I wanted to just jump on here really quick and go over some new um, updates that I've seen from the summer clinic that's been posted in the support group on Facebook. And so just wanted to fill you in case you're not on the group and not uh, getting his updates. He has a YouTube channel as well, some Summer Clinic. I suggest you subscribe to that so you can stay up to date. They're working on research that's going to help get maladaptive daydreaming disorder into the DSM so that doctors will know what it is. And so when someone goes to them for help, they're not going to just be dismissed, but or wrongfully diagnosed. And treatments can actually be developed through this kind of research. So, okay, let's see what. Um, I guess I have to go to the other. I'm not so used to doing this. Let's see. This is an announcement about.
Share with you the significance of the newly established International Society for Maladaptive Daydreaming,
Can you hear that?
ISMD. I'd like to talk to you about its pivotal role in raising awareness about maladaptive daydreaming globally and among professionals and scientists. The ISMD stands as a beacon of hope, uniting mental health consumers, researchers, and clinicians in a new democratic and egalitarian organization. This unique society fosters maladaptive daydreaming awareness globally, emphasizing collaboration and inclusivity in its mission. One of the most significant challenges faced by the maladaptive daydreaming community in it is the inclusion of maladaptive daydreaming in essential psychiatric classification manuals like the DSM and the ICD. This is a crucial step. It is vital to legitimizing maladaptive daydreaming as a recognized mental health condition and ensuring appropriate support and treatment for individuals affected by it. With your help, the ISMD can play a vital role in advocating for recognizing maladaptive daydreaming by building a solid and unified voice uh, through its diverse membership base. The society will actively engage in advocacy efforts to push for the inclusion of maladaptive daydreaming in mainstream psychiatric classifications. The collective strength of ISMD members is instrumental in driving this advocacy forward. I invite you to join this transformative movement by joining the International Society for Maladaptive Daydreaming. By becoming a member, you contribute to a noble cause and gain access to a range of attractive benefits at an affordable fee. Together, we can make a difference and shape the future landscape of maladaptive daydreaming awareness and support. So, in conclusion, maladaptive daydreaming research is evolving rapidly, and the ISMD is at the forefront of this progress. Let us stand together, raise our voices, and work towards a future where maladaptive daydreaming receives recognition and the support it deserves. One benefit of the ISMD is the opportunity to meet and interact with researchers and clinicians in the field. Go to maladaptivedaydreamingsociety.com. I repeat, Maladaptive Daydreaming Society, one word.com, to learn more about the ISMD and support it by joining. I invite you to join me in the first ISMD webinar, which I will present on Friday, March 29th at 6 p.m. Central European Time, 5 p.m. Britain, and noon on the East Coast of the United States and Canada. See you there.
Well, that's interesting. Everything that can be done to bring more awareness is definitely a benefit for those who are suffering with this disorder and trying to get it under control to where we can move on with our lives and daydream normally. Now this sounds, I haven't went to the website yet, but this sounds like it is a paid membership. So that might not be for everyone. I mean, if you certainly, if you can, I'm sure that would help forward the research. But even if not, it's good to know that things are moving forward to help get this into the awareness of doctors. Because right now, most doctors, when you go, they're not going to help you because they don't think it's a real thing. So until it gets in the actual diagnostic manuals, a lot of people are not going to get help. So I'm glad that they're doing more stuff like that. And there was another. Let's see, he had another thing that I thought was very interesting. Excuse me. If I can get my page to stop jumping so I can get to it. Okay, now this is a video called "Was It Real or Did I Daydream It?" And it's talking about whether or not maladaptive daydreaming affects your real memories. So let me get. Okay, now here's a video where he's talking about how maladaptive daydreaming affects memories. I have read that your brain does not differentiate between a fantasized memory and a real memory as far as the way it stores them. And I've always worried, especially when I get older, when you start having memory issues, am I going to have things that happened in these maladaptive dreams that I think really happened because I can't distinguish between a real memory and something that happened in one of these daydreams? And that's scary. So, I was interested to see that this is something that they have been looking at. And to be honest, I was kind of surprised with their results. But let's see what he. Now, I'm going to have to try to, I think, mute my mic in order for his to play. We will see how that works.
Hi, everyone. Although daydreaming seems to have close ties with source confusion, that is, a source as to where the memory came from, and memory and the quality of memory, research on the link between these concepts is sparse. We conducted a study to examine the association between maladaptive daydreaming, source confusion, and memory errors. I'd like to report to you the results of this study and a subsequent one that followed it. We asked participants with elevated maladaptive daydreaming scores, we asked them several questions about daydreaming and memory. 51% confirmed that they had experienced a daydream which they later considered an event that they had experienced. More specifically, when inspecting their answers, the following 5 response themes emerge, and I will elaborate on each one later on. The first theme was a blurred fantasy reality boundary. Second, maladaptive daydreaming and social interactions, how they are being confused or not. Daydreaming influencing memories of today, and daydreams and memories missed, and also realizing memories were dreams. So I will now elaborate on these key themes. A common denominator, I must say, connected these various themes. Most confabulated storylines actually correct a negative past occurrence or rehearse a potentially grim future one. Our findings revealed that individuals who experience maladaptive daydreaming may report confabulations, that is, create false memories of plausible or desired experiences. Examples of the theme of blurred fantasy reality boundaries demonstrated that the risk of confusing fantasy with reality increased when daydreaming included scenes and persons from the participants' actual lives.
Okay, so that's interesting. So he's saying it's more likely that your memories can get confused if your daydreams involve people from your real life. So I'm probably safe from that anyway. And at the beginning, he said that this study targeted people with a high maladaptive score. What does that mean? I don't know what that means. Okay, well, I'm going to mute myself again and see what he says on this next couple of points.
This finding has reminded me of findings of false memory research that showed that incorrect memory formation are created around events of which people have some knowledge about. Past research has demonstrated that when people are told that they experienced a false event of which they have limited background knowledge, for example, a rectal enema, individuals are less likely to form false memories than when they are given false or misleading suggestions that they experience an event of which they have more knowledge, for example, getting lost as a child. This is because false memory creation is more likely when people associate such suggestions with existing knowledge, activating non-experienced details. Such activation can then generate the production of false memories. Concerning the second theme regarding the daydreaming and social interactions, our data show that mentally rehearsed behaviors such as conversations or interactions with friends or family can lead to the reporting of a memory. These findings support past research on imagination inflation, indicating that repeatedly imagining non-experienced events that are plausible increase the confidence that the event was indeed experienced or the action was executed. The explanation for this imagination inflation, for this effect, is that repeated imaginations lead to mental representations sharing similar features. For example, the number of visual details, the vividness, they're the same in terms of quantity and detail when imaginations are rehearsed and repeatedly rehearsed. So these kind of mental behaviors can create mental representations that could seem to the daydreamer as originating from real events. So source monitoring errors might evolve when this happens, leading to false memories. We also found examples in our theme of blurred memories due to daydreaming that participants attempted to amend a real-life undesirable event. This result is interesting as it dovetails with research on the therapeutic effects of imagery rescripting. What is imagery rescripting? In this, it's a therapeutic intervention in which patients are asked to retrieve a traumatic memory. They are then instructed to change or rescript a negative emotional memory into a positive one using their imagination. Evidence indicates that this intervention can reduce various psychopathological issues. Finally, our data also showed examples in which others refuted memories in the respondent's social context, thereby making them realize that these memories were false and were likely daydreams. These examples echo research on non-believed memories, which refer to memories of events in which the belief in the occurrence of those events is reduced. This research has revealed that social feedback is one of the most potent factors leading to such non-believed memories. That is, this research shows that people are likely to reduce their belief in the occurrence of an event if others tell them that the memory is wrong. In a second study on maladaptive daydreaming and memory, we examined the nature.
My computer's not being very responsive when I click things. Okay, so on some of the things he said, one, this looks like, another way. A lot of people say that maladaptive daydreaming is a coping mechanism, but so also I guess if this is like your brain's automatic way of replacing traumatic memories with less traumatic ones, then it is again is a coping type healing mechanism that your brain uses to protect yourself. But now, just to put it out there, you can have maladaptive daydreaming and not have been in trauma. Sometimes it just happens. You know, like epilepsy can happen from a brain injury, but it can also just happen. So I want to throw that out there. I'm not saying that everyone with maladaptive daydreaming has trauma, because I didn't have trauma, but I have maladaptive daydreaming. Um, and what he was talking about, I don't remember what he called it, but I saw something about that years ago. Very interesting how they could use people who were dealing with PTSD from combat situations. They were using virtual reality helmets to put them in very similar situations to what they had experienced that was traumatic, but to have the outcomes be not traumatic. I don't know what the opposite would be called, but like instead of gunfire, it's a normal social scene, people laughing and being nice, and to help some of these people had trouble, like even going through a door because of situations where they would go in and there'd be a gun at the other side of the door. These kind of things, so retraining your brain. They've done that with virtual reality technology, and it seems like he's saying that this is something naturally that a maladaptive daydreamer is doing. Um, but then again, this is just my opinion. But I think it would be kind of dangerous when you think about it. If you had a traumatic experience with someone, like there are some bad people, and if you had an interaction with a bad person, and then years later your MD has gone over this interaction over and over and over again, making it a little less bad every time to where it's no longer a traumatic memory, and when you think about this person, oh, they weren't so bad, you might be in danger of actually allowing that person to hurt you again or something like that. So I'm just saying, I can see how it could not be a good thing, because not remembering correctly, I think, can be a bad thing. Because sometimes remembering that that snake's gonna bite can keep you from getting bit. Okay, sorry. Now I'm gonna see if I can get him turned back on.
Nature and scope of traumatic daydreaming among individuals with maladaptive daydreaming. We wanted to understand how these individuals experienced the relationship between their traumatic daydreaming and I mean the scenarios of traumatic daydreaming and real adversities that they may have suffered in real life. In doing so, individuals were asked questions during an interview concerning the occurrence of trauma in childhood, whether they have daydreamed about trauma, whether they noticed any connection between their trauma-related daydreams and authentic experience, and fourthly, whether they ever had any difficulties in deciding if a traumatic memory originated from a daydream or an actual event. Many respondents, 56%, described past trauma events related to stressful family environments, social isolation, emotional and physical neglect, witnessing violence, sexual abuse, and most frequently bullying. These data show that trauma could be, in some cases, an antecedent to maladaptive daydreaming. Related to this, a slight majority of respondents also noted that their childhood traumas are sometimes reflected in their daydreams' content. Specifically, we found examples of daydreaming about negative experiences of trauma and creating corrected versions of the experienced trauma. The latter is especially noteworthy because it suggests that during maladaptive daydreaming, childhood adversities are rescripted, which could aid in coping with the trauma. This might indicate that, at least for some individuals, maladaptive daydreaming can be regarded as a specific form of a coping mechanism. This latter finding also echoes another observation of our study. Most respondents did not confuse their immersive fantasies for a traumatic memory that is based on a real experience. So although research shows that the act of imagination can trigger the formation of false memories, our data did not support these findings. The corrected versions in our respondents' daydreams probably served as distinctive markers that decrease the risk of source confusion. Things that stand out are less likely to be misremembered later. We know that. Our brains are good at remembering things that are different or unusual. For example, imagine that you see a black car on your way to work every day. It's pretty ordinary, right? So you might not remember all the details about it later. But if you saw a bright pink car with purple polka dots, that would be much more memorable. Because it's so different, your brain pays more attention and is less likely to mix it up with the other memories. In conclusion, our second study found that a significant portion of individuals with maladaptive daydreaming reported prior trauma, with some incorporating those distressing experiences as themes within their imaginative content. Participants indicated that their daydreams often depicted traumatic events, but they did so in a corrected or positive manner compared to how the adversity originally occurred. Additionally, most respondents stated that they did not mix traumatic scenarios from their maladaptive daydreaming with authentic past personal experiences, suggesting an intact reality testing, and thereby a reduced risk for false memory. In conclusion, while daydreaming allowed for imagination and fantasy, it can also lead to blurred boundaries between reality and fiction. Importantly, though, for some individuals, the act of rescripting negative memories through immersive daydreaming may prove therapeutic, creating more positive mental representations. Additionally, reality testing appears intact for many maladaptive daydreamers, with traumatic fantasies correctly identified as imagined rather than real. As we continue unraveling the cognitive implications of excessive fantasy, we must consider both its risks and its potential benefits in coping and well-being. With nuance and compassion, future research can outline best practices for those who retreat into vivid inner worlds, ensuring their imaginations enrich rather than endanger their lives. Thank you.
Hmm. Okay. Well, that was interesting. So, his conclusion is again pointing out that maladaptive daydreamers usually are pretty good at telling the difference between reality and their fantasy, which is good to know. Um, so if they can come up with treatments and things to help us keep it under control to where when we need to be working, studying, doing, we can cut it off, then having a great immersive imagination will be a wonderful thing. But when it's running all the time in your head, when you can't pay attention to driving down the road or talking to somebody, it's much more problematic. So I'm glad they're continuing to research and hope they will continue to research. And thanks for stopping in and checking out what updates. And like I said, go check out the Summer Clinic YouTube channel to keep up with all the updates. And I will see you guys in the support group.